Eyewitness News is your vaccine authority, and every day we are committed to getting you answers. Joining us live is Dr. Janelle Chiasera, Dean of School of Health Sciences at Quinnipiac University. Doctor, thank you so much for being with us.
My pleasure.
So let's get right to these questions. Here's the first one. I got the J&J vaccine at Oakdale and Wallingford in March. Is there a way to find out if my vaccine came from the plant charged with unsanitary conditions? Do I need to worry?
This is a great question. So I do want to just preface my answer with, the Food and Drug Administration did release a pretty lengthy report detailing findings from their just completed inspection of that Baltimore factory that was hired to help make the J&J COVID vaccine. The good news is nothing made at that factory for J&J has been distributed. That's what the FDA noted. The nearly 8 million doses of J&J vaccine that have been given out in the United States came from Europe. So to answer the question, they asked about tracking. Yes, there's a tracking system. You can do this through the vaccine's lot number that's printed on your vaccine card that you were given when you received the vaccine. And then the question was, do we need to worry? Probably not, as you would have probably already been notified by the manufacturer if your lot number was involved.
All right, I'm pretty sure that's a big relief to a lot of people. Here's the second question. As a patient with a blood clotting disorder, are there any studies in regards to the vaccines and reactions for individuals such as myself? Obviously, there's been a lot of talk lately about the possibility of blood clots after these vaccines.
This is an interesting question because this is a developing story. The experts really emphasize that much more is still unknown than known about this whole thing. But I will share with you a couple of takeaways that they know right now. Experts still do not know whether the vaccine is related to or caused the blood clotting issue. The pause is being recommended right now over an abundance of caution so that the scientists can review this data and decide if the vaccine recommendations may need to change. I think it's important to let you know that the specific blood clotting disorder being studied is exceedingly rare and not the same as other types of blood clotting disorders that are a little bit more common. So, if you're scheduled to get a different COVID vaccine during the pause, you should still get it. No cases right now of this blood clotting issue have been reported among the more than 180 million people who received the Pfizer or Moderna vaccines, according to the CDC. My recommendation for you always is to contact your physician. Your physician has the full picture of your medical conditions, and she or he can best guide you regarding that clotting disorder.
All right, a lot of good information there. Also, there's been so much talk about all these new strains that keep coming out. So this question, particularly pertinent, is the vaccine effective against the new strains, and how long would that immunity last?
So we know that immunity after COVID infection lasts about 2 to 3 months. Immunity after vaccination, the data so far shows about 6 months immunity, and that immunity does include immunity to the variants. So the faster we get everyone vaccinated, the faster we can drastically slow the creation of those new variants, because those variants are created within us.
Absolutely. Well, thank you so much for your insight and expertise, Dr. Chiasera, Dean of School of Health Sciences at Quinnipiac University. Thank you so much.